Well, hello and welcome to Wellness by Design today. I'm Jane Hogan, the Wellness Engineer, your host. And today we are talking about something that I think pretty much affects everybody. Um, has had a headache at some point. Now, some people suffer from worse headaches, migraines over and over again. And I'm really delighted to have Dr. Amelia Scott Barrett here today. She's an expert in headaches and not just masking the symptoms, which, we talk about that a lot. We want to get at root causes, not masking symptoms. And that's really how we find long-term healing. So welcome, Dr. B. I'm so happy to have you here.
Hello, thank you so much for having me.
Well, this is such a great topic, and so many people need to hear the message. So, you're a medical doctor. You could have be working on absolutely anything. Like, why have you decided to specialize in headaches and migraine headaches? What's your passion with this topic?
I think it really stems back to my frustration with the limitations of medications. So I remember probably 10-ish years ago now, I was in my office with one of my favorite patients who was working so hard to get rid of her headaches. I mean, she would do anything she found on Google, she would try. And we had been through like a dozen different medications. And still, she was spending a day or two a week in bed. She had several kids, she had a job. I mean, she's just this incredible person. And I just remember this transformative moment where I handed her a prescription for a medication. And I just knew deep in my soul that it wasn't going to work. And not because not because medications are bad necessarily. I mean, people can get side effects. That's not what I'm saying, but I'm just saying they don't fix the underlying problem. And so I became much more interested in trying to bring resources together to help people actually heal, not just to put a Band-Aid on the pain at the end of the process, but to really swim upstream, figure out what was going on to cause the headaches in the first place for these people, because I just didn't want to hand people prescriptions anymore that I didn't think were going to really change their lives, really give them their lives back, really allow these women to plug in to who they wanted to be and what they wanted to do with their lives.
Oh, yeah, it must be so frustrating uh, when you don't have too many tools in the toolbox and you've just got this one and you know in your heart that it's not working and your oath is do no harm, but you really want to help, right? You
Yeah.
became a doctor because you wanted help. So you started then investigating root causes. Was this something you did on your own, or was this something you learned in your medical training?
No, this was pretty much on my own. So I jumped outside the box of conventional medicine. I still have one foot in that world. I still see patients, I still prescribe medications, but I just have a much bigger picture about what healing looks like at this point. So the first thing I did was to explore yoga more deeply. Yoga was the first tool I found that impacted my migraines. So my migraines start in the back of my neck, right here, and they'll radiate forward, usually for a couple of days. And then I get the aura and then the nausea and the throbbing and all the things. I'm sure many of you out there can relate. But I had found at this point in my life that if I do the right thing, then sometimes I can avoid getting the migraine. If I can really treat that neck pain early on, get myself calmed down, get rid of the stress, get back to sleeping, relieve that pain in the neck and upper back, then I could steer clear of those migraines, not have to get them, not have to take the medications, not have to go through that whole thing. So that was really my first personal experience with the idea that, hey, we can take a step back. We can fix some of the things that cause migraines and make it so we don't ever get them.
Hmm.
So, yeah, my journey began there. And eventually, I went on to discover functional medicine as well. My daughter was diagnosed with celiac when she was only 4.
Oh my goodness.
So yeah, so
Oh.
I kind of came home and threw out the whole pantry and started over. And I mean, I'm a busy mom. I'm not going to make two dinners at night. I'm not going to make one gluten and one gluten free. So I started eating gluten free, and I eventually noticed a connection there as well. I started to understand that when my belly felt big and swollen, that was actually a reaction to the gluten. You know,
Yeah.
I always thought, oh, I just ate too much or whatever, but it ended up being a reaction to the gluten. I became more tuned into my body. I could understand how I was feeling, inflamed. I would get hand pain, more headaches, obviously, couldn't think as well, had less energy. And so that was kind of my wake up call about the effect of gluten on my body. I don't have celiac like my daughter does, but I still very clearly react to it. So again, same experience. I became super interested, like, wait, hey, what's going on here? I need to learn more about this so that I can help people learn how to swim upstream, so to speak,
Hmm.
and fix those underlying causes of headaches before they ever actually happen.
Hmm. So you've had your personal experience, and it's pretty amazing what can happen with gluten. Like, and that I think I don't know what the percentage of the population, but it's a significant percentage of the population is actually sensitive to gluten. And so I did functional medicine health coach training, and we learned that in there. Pretty much, if you've got inflammation, that's something you need to avoid. And for me too, like I stopped eating gluten, and within 5 days I had like a big reduction in pain. So it was like it was too big to ignore.
Yeah.
And another thing, nothing to do with headaches, but my husband, well, he did the same thing and reminded me when you were talking about we're not making two meals. So if I wasn't eating gluten, we both weren't eating gluten, and our kids were grown up, so it was just the two of us. And he had been on blood pressure medication for years, and all of a sudden he was like starting to get lightheaded, and he went to see his doctor, and his doctor's like, I've never seen this, but I think I have to reduce your medication. And eventually he went off it, just from like all he's done is change the way he's eating. And he hasn't gone as far as I did with a lot of things, but it's amazing how can impact so many parts of your life and your health. And just before we recorded, you and I were talking about how um, these are such common root causes, and they just affect different people in different ways, and that's where the genetics come in. So let's talk about some root causes. We talked about gluten, but like, what are some other common root causes you see of headaches, migraines in particular?
Simple nutrient deficiencies. The brain is a very demanding organ, honestly. It's very particular about what it wants. And so there are probably half a dozen different nutrient deficiencies that really impact how your brain functions. And they are not things that neurologists are taught to check for in patients who have migraines. But when we give the brain everything that it needs in order to function optimally, the brain stops giving us as many pain signals. I really view headaches as your brain's way of talking to you.
Oh,
Your brain is trying
yeah,
to give you a message, and
yeah,
you should not answer back with a pill.
yeah,
We need to listen to those messages and try to figure out what the brain is saying. We have so many more tools available to us now to do that. So just as
yeah.
an example, I often check an omega-3 index in my patients or in my students who I coach online. And there was a study published in the British Medical Journal in May of 2021 that showed if you increase omega-3 intake fairly substantially, they had these people eating fish every single day and some other things. So, I mean, it was a legit diet change. But if you do that, it cut headaches in half in
Wow.
3 months. I mean, that's a huge impact. That's as good as any drug out there. That's an incredibly powerful tool that every single one of us has available to us. So, and so it went down to half. It wasn't 100%. So which people really need this, which people don't? Well, the people who need it are the people who are really low
Yeah.
on the omega-3 index. Obviously, they're going to respond much better than the people who are already okay on that particular measure of brain nutrition. So that's just one example, but there are many factors related to brain nutrition that are relevant for headaches that most doctors do not check.
Mm. What are some of the other nutrient deficiencies?
We can see, I mean, even vitamin D is very much linked with mood and memory, and vitamin B12 deficiency is one of the more common causes of memory loss, brain fog, and that is often part of the picture for people who are having frequent headaches. That many people tell me that what bothers them most about their migraines is that they can't think straight. You know, when they have it, when the headache is over, and that is exacerbated by B12 deficiency. And
Mm.
then there are, of course, other root causes as well. As we were talking about with gluten, people can get intestinal permeability or leaky gut.
Yeah.
And what that means is that your immune system can react to the food in your intestinal tract. That's not supposed to happen. Normally, there's a solid barrier between your immune system and the food inside your intestines. But if it becomes permeable due to damage, which can happen from many things in our modern world, then suddenly your body is reacting to foods that revs up the immune system. And then when the immune system is revved up, it makes chemicals that cause pain. So you probably see that in your work with chronic pain patients as well.
Yeah, yeah. There's so many different causes, but yeah, a lot of times chronic pain, inflammation is associated with gut health because that's where most of our immune system is and where it's getting triggered a lot of times. So, yeah.
Yeah.
Um, so, uh, so we've talked about leaky gut and gluten, and so is that a food sensitivity, would you call it?
It can be. It can simply be a reflection of the fact that there's permeability in the intestine. So your immune system is seeing stuff it doesn't normally see. It could be that. And really, the solution is just to seal up the gut, and then you won't react to it anymore. It can be a non-celiac gluten or wheat sensitivity. That absolutely happens as more of a quicker response to the antigen, the gluten or the wheat. So that can certainly happen as well.
So do you, as a protocol, kind of start everybody off with removing gluten from their diet?
I do recommend it for
Yeah.
everybody, unless we have food sensitivity or food allergy testing telling us that that really isn't anything that the body's reacting to. But I think if you were to just give blanket advice that's going to work for most people, eliminating gluten would be the first step. Yeah.
Yeah, yeah, it's amazing how that can make such a difference. I've had clients that say it's the headaches that they can really notice a difference with when they cut out gluten. So, yeah,
Mhm.
interesting. Um, what are some other common root causes?
Toxin accumulation. We are learning more and more about this now that we're able to test for all of the toxins in our environment, whether that's glyphosate, phthalates, BPA, mercury, or other heavy metals, even things like mold you could consider to be a toxin. So
Yeah.
some people have abnormalities in their detox pathways, including me. 1 in 5 people with migraines has an abnormality in what's called the GST gene, glutathione S transferase. 1 in 5. And we've known this for 20 years in neurology. It's just that we haven't been sure what to do with this information. You know, you got to remember when I started off my career as a neurologist, we had not sequenced one human genome, not one.
Right.
And now any of us can get online and order it today at a fairly reasonable price. So our world has changed so fast. So one of the things that we know to be true is that many people with migraine do have abnormalities in their detox genes. It's now possible to find out if you are one of those people. And also because our understanding of how the body detoxes, biochemically has progressed so much, now we have a much greater understanding of how to help people detox. So many people sort of think of genetic testing and do this, they put their hands on their ears and go, la, 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 la. I don't want to know. I don't want to know if I have some horrible problem I can't do anything about. But that's not the case. There is something you can do about it. especially
Mm,
in cases of, problems with your detox pathways. You just know that it's much more important for you to reduce the toxins that come into your body and to also help your body eliminate those toxins more effectively.
I mean, I think what we know about genes is that there's very few illnesses that are, the cause of one gene, right? The
Yeah.
rest of them are, a combination of things going on. So and it's the environment that's turning or dimming up or dimming down the expression of certain genes, and we have control over that environment, right? So we've got a control over what toxins we may be exposing ourselves to, but also control like opening up detox pathways. So what kind of things do you teach your coach your clients or your patients on when it comes to opening detox pathways?
Well, I think people need to understand glutathione. They need to understand how glutathione is made in the body, all of the cofactors that are important for glutathione synthesis, and also how your body takes glutathione, links it to a toxin, joins them together, and then eliminates them from the body. So I think it really starts with a fairly detailed understanding of that process. Because once you understand the process and all the things that go into it, then I think people are more on board with making the changes that need to be made in order to help your body detox.
Mm.
So I like to use the mnemonic of eating PACES foods, PACES, protein, ALA, vitamin C, vitamin E, and selenium. And so teaching people, okay, which foods have those nutrients in them, because that's what your body needs to make more glutathione. And you can absolutely do this through food. You can absolutely do this through supplements. I think people get the best results when they use both, because supplements are just sort of an extract of one small piece of the puzzle. But, we really evolved eating food, not supplements. So I think that there are many things inside food that even modern science hasn't fully figured out. And so we do definitely need to try to get all of those important ingredients from what we eat. And it's fine to supplement with, just the extract form in the supplement, but you can't eat Cheetos all day long and take detox vitamins and expect things to work right. You have
Right.
to do the hard work and actually eat the foods.
Yeah, and we don't even know, like you said, that this synergy with foods, it's packed
Yes.
beautifully in nature, right? We can't recreate that in a supplement. So I
Yeah.
really like what you said there. What about things like, do you do things like old-fashioned things like the packs, what are they called? I'm having a little blank, but the castor oil packs, that's the word. Do you do things like that for detox? Is that something you?
I haven't gone with that as much, but one of the old time strategies that I do really like is sauna. Um,
Yes.
yeah, I mean, I have read some very interesting studies showing that we do actually excrete heavy metals in our sweat. They've done these very detailed chemical analyses of collecting people's sweat, and you
Nice.
find very high levels of heavy metals in sweat. And we've gotten away from sweating in our daily life, right? We spend our days indoors in air conditioning. We have air conditioning in our cars when we do go outside, even when it is summer. So I think that, we really need to bring some of that back in, whether it's just naturally being outside, whether it's gardening, walking, whatever it is that you do. And we probably have to enhance that by having a little bit of sauna. And I'm just guessing in your neck of the woods sauna is probably more common than it is in other places, just because it's so darn cold.
People like their saunas here.
Yeah.
And what's interesting about sweating is that, it's a natural process as well, right? So it's not going to be too fast. Like a lot of times when people try to detox, it's too much too fast, and then they have reactions and they feel worse. And so I don't know. Like, will your body always do it in a way that it can handle it if you do it naturally, like with the sauna?
I do think people can get some detox symptoms. I definitely have noticed that, so I take people through a very long process that takes several months, and we seal up the gut and then turn on the body's detox pathways at the same time, reduce the amount of toxins coming in. And some people do feel a little worse in those first couple of weeks, and they need to take a break, which is fine. But part of it is that when you're pulling those toxins out of storage in your body, which is partly in fat tissue, then they're in your bloodstream, they kind of cause symptoms again.
Yeah.
In that transit time between when they're sort of pulled out of storage and eliminated from your body. So then, we just slow it down,
Right.
and give your body more time, let those pathways settle back down a little bit, ramp it back up again. But I agree with you. Yeah, it can be tough to do a real detox. And I'm not talking about, a 3-day juice cleanse. I'm talking about true detox, working with your body's own detox systems that are built in and ramping those up, pushing the throttle on
Hmm.
those endogenous detox pathways.
And do you do things like lymphatic drainage, like, massage and things like that, and getting those lymph nodes, the whole lymph system open and flowing?
Yeah, I think that's an important part of it for most people. And honestly, I don't know anybody who will turn down a massage for any reason. So just give me one more reason to do that more often. I'm good with it.
Yeah, and I've gone to my massage therapist, and you can get specifically a lymphatic drainage type of massage, which is, different than therapeutic, another type of therapeutic. I guess it's a type of therapeutic massage. So that might be
Oh,
something people could ask for, right?
yeah, I'm totally fascinated by that. What do they do that's different?
It's very light touch on the skin as
Okay.
opposed to deep tissues, because I guess a lot of that lymph fluid is kind of in the connective tissue, right, which is closer to the skin surface. So it's super super light. So sometimes I think like, oh, it's not a real massage, but it is actually doing stuff. So yeah, and so I think the lady that I go to is specifically trained in that. So it's just something that she offers. So it's something people could look for with massage.
Mhm.
Okay, so um, I wanted to mention, yeah, somewhere along the way, or early on, you talked about, you mentioned women in particular. Do you see migraines and headaches more common in women than men? And if so, why is that?
Oh, absolutely. Migraine is the number one cause of disability in women under 50. Yeah.
Wow.
It is a huge problem in young women. And these are women in the prime of their lives. These are women who, get taken out of the workforce. These are moms who can't be with their kids anymore. It is a huge
So sad.
problem. And, I think there are a lot of factors that go into that. I think one piece of the puzzle that just breaks my heart is that I feel like many women are working so hard to take care of everything and everybody that their own health gets put on the back burner.
Yeah, I see that a lot
Yeah,
too. Chronic pain.
it's
Yeah.
yes. Yes, exactly. And they get into this mode of I'll just pop a pill and power through, and then they pop a pill and power through again. And because they haven't fixed those underlying problems, the brain just keeps having repeated migraines and goes into a process known as chronification. Now, neurologists have known about this for a long time, but I feel like word hasn't really gotten out to the people who need to hear it most, which is those women who are popping a pill, so that they know, you're not truly fixing the problem. Your brain is trying to give you a message. Your job is to listen and figure out what those root causes are, to actually take care of your own health just as well as you take care of the health of your children, your family, your community. And I just hate to see these women who are such givers, such hard workers,
Mhm.
get taken out because they're popping a pill to try to show up for their family, to try to follow through on their obligations, to try to beat their migraine disease and, be present for their family, but it's hurting them in the long run. So, that is a big part of my mission. I just did a TED talk about chronification because I really want to raise awareness that this can happen. People are walking on the edge of a cliff and they don't know it.
Mhm.
And they need to be aware of those dangers of not paying attention to the underlying problems and fixing those underlying problems.
So true. What can you
Mhm.
explain what chronification is again? Just
Yeah.
spell it
Yeah,
out.
happy to. Yeah. So basically, what happens when you start having repeated migraines is that the brain is firing too much. And this results in a number of different problems in the brain. First of all, there are pathways that sort of tamp down pain signals in your brain, and they can get so overworked that they basically just short out.
Mm.
And you can eventually see deposits of iron in these parts of the brain on imaging, on MRI, and things like that. I just
Wow.
find that to be incredible that something we think of as being so benign, oh, it's just a headache. Well, actually, it's resulting in iron deposits in the parts of the brain that are working so hard to tamp down those pain signals. So that is one of the changes we can see on scans. The other thing we see is enlargement of the parts of the brain that handle emotion. So people start getting more problems with anxiety, depression, mood swings. And this is all just happening, of course, right at the time when they need their emotional bandwidth, right?
Yeah.
Headaches are spiraling out of control. Things are crazy. It's starting to impact their life. And what happens? The amygdala gets bigger and then the emotions get even crazier. So that's a problem. And then we even see things like, sensations feel abnormal. So I led a headache wellness retreat in February in Mexico, and one of the gals who came could not put her hair in a ponytail because it just hurt too much. Her scalp was just super sensitive.
Yeah.
And so what's happening there is that the temporal lobe is overfiring. It's a part of the brain that processes sensory information. And so it's misreading those pain signals. It can't function properly anymore. It's thinking that a ponytail is painful when, of course, it shouldn't be, but
Hmm.
the brain is in an abnormal state. So that's how it processes those signals. And that's the message that you get. Nope, that hurts, not going to do it. So the effects on the brain are actually fairly profound, and people get new neurological symptoms, they get new mood symptoms, and it sets up this process that can really spiral out of control.
Hmm.
So, people end up in a situation where their medications don't work as well as they used to, and then they're really in trouble. And that is how migraine ends up being the number one cause of disability in young women.
Wow. That's shocking to me. I did not know that.
I
How much
know.
do you incorporate like mind body techniques in helping people get at root causes of the headaches?
Well, I think that the true niche for those techniques is in helping us rebalance the autonomic nervous system. So the autonomic nervous system is the fight or flight, chasing a tiger that we've all heard so much about, and the parasympathetic nervous system, which is our recovery system. So healing does not happen in fight or flight.
Right.
It doesn't. We all know that the body has enormous capacity to heal itself. That's what the placebo effect is, right? You
Yeah.
take a pill, you think you're healing, and your body does the healing on its own, even though there's no chemical making that happen. So we know that the body can heal itself, but that only happens when you're in parasympathetic, when you're in recovery mode. So I think that the real niche for those tools is in helping people get off that teeter-totter of the nervous system, right? Like if you
Yeah.
imagine the nervous system as a teeter-totter here, then people in chronic pain are shifted over into fight or flight because that's what pain does. It triggers the release of cortisol and stress chemicals.
Yeah.
And so it's a big job for people to shift that teeter-totter back to neutral and get the body into more of a balance of the nervous system. It's doable. We have thousands of years of tradition in yoga and meditation to tell us how to do that, that is being validated by modern neuroscience. So we know that it works, but it is a lot of work. These are new tools people need to learn. They need to learn which particular techniques are actually effective and which ones aren't.
Hmm.
So I view those as incredibly powerful tools for shifting the
Hmm.
nervous system back into balance.
Yeah. Yeah. So we're saying that stress is also right, which pushes us into that fight or flight mode, the sympathetic state of the nervous system. That is also a root cause then of the headaches and so many other
Absolutely.
things. So many other things
Absolutely.
as
And it's
well.
sort of a chicken egg thing because, maybe you just had a stressful day, but then it sets off this 3 days of pain for your migraine. And then your body stays in stress mode for 3 days. And then because you're in stress mode, you didn't have a chance to recover. And then that's shifting your nervous system out of balance again. It's just this vicious cycle.
Yeah. And the challenge with those mind body techniques, I mean, I really uh, encourage people to do them as well. In fact, I think it's absolutely necessary, but it's that time factor. And so what you're saying, that's such a challenge for younger women who are busy. They probably have young families, and they're trying to work and do it all. So how do you help them carve out the time to do this, to get themselves into the parasympathetic state?
Yeah, I think there are a couple of factors. Number one, they need to see the data so they understand that it works. Um,
Right.
Number two, they need to see the numbers in their body right there in black and white. Your stress tank, the chemicals that give you your tank to deal with stress. Your stress tank is low. They see the numbers in black and white and they're like, oh, this affects me. Oh, these techniques actually work. So then they're more willing to prioritize. And then the third
Yeah.
thing is these techniques are not easy to manage if you have the targeted goal of trying to relieve pain. So if you go to the gym and do a yoga class, I mean, it's practice, it's a workout, right? It's not a work in, it's a workout. So many yoga classes are that way, that they're not about shifting the nervous system. They're about strengthening, they're about cardio, and
Yeah.
that's not the most effective path. So I think that the resources are actually hard to find. So that is part of the reason that I teach also. I became a yoga teacher and I
Me
teach yoga
too.
and meditation to my people so that they can learn just the most effective things in the quickest amount of time and really incorporate effective strategies into their lives.
Yeah, I did the same thing. I was like, this is so
Did
powerful. I
you?
want to be able to teach it. And
Cool.
yeah, like you said, I mean, I've gone to those yoga classes, like, we're having a workout today. Like, no, this is not what
I
it's about.
know.
And the breath work too, right, is so powerful to help people relax. And it's a big part of the traditional, actually, yoga began as breath work. I don't know if you knew that. I only found that out about a year ago, that it started as breath work, and then they started adding the asanas to, okay, while we're breathing, we're going to do this. So it began as breath work, and that's so much power in that, and just a great way to just, bring that stress right down.
Yeah.
Okay,
Yeah. Interesting. I did not know that. Yeah.
we've covered a lot, Dr. B. Is there anything else that you wanted to make sure the audience knows about headaches, and what root causes, and,
Well,
and ways they can deal with them?
yeah, I would like to give a resource for anybody who is listening to this and thinking, uh-oh, I wonder if I'm in chronification and what I can do about it. I created a quiz to help you figure that out. It's
Yeah.
at theheadachequiz.com. Super quick 5-minute quiz. It'll let you know if this is something that you need to, put a little higher on your list of priorities. And I have all kinds of resources. There's really something for everybody, no matter what your budget is, no matter how much time you have. It is my whole goal to meet people where they are on their health journey and help them move forward. And so, after you take the quiz, I connect you with resources that I think are most likely to be helpful for you. So
Oh, that is so good. I will have the link there in the show notes, so you can just follow the link. What a great opportunity for people, and it's not like 5 minutes. It's very quick to do that quiz. So that's
yeah.
fantastic, Dr. B. Okay, this
Yeah.
show is all about intentional living, right? So that we can create an environment that's going to set the stage for wellness. So, what would you say is one thing someone could do today to begin to initiate healing? What's the one baby step?
Oh my gosh, there's so many. I only get to choose one. Let me
I'm making
think
this hard for
deeply
you.
here. Okay. I think for migraines, I'm gonna go with this. For anybody with chronic headaches, start taking magnesium.
Mhm.
Almost everybody benefits from magnesium supplementation. I think there are a couple of problems with that can happen with this. So I'll just, give you an idea of what those rocks are in the stream that you may bump into as you're trying to implement. Number one, side effects. If you notice that the mag gives you stomach side effects, just drop your dose back down and try again. Okay, give your body more time to adjust. Number two, be careful where you buy your supplements. There's a lot of fraud out there. Please be sure you buy something that's third-party tested.
Hmm.
And number three, make sure you're buying a kind that is highly absorbed, a chelated magnesium like magnesium glycinate,
Hmm.
and take a dose somewhere between 400, 500 at night. And last but not least, be patient. It takes a minute. Most people are so mag depleted that it really takes a couple of months to fill up your tank. You will notice a benefit. It will get better. But I find that many people get stuck on any of those rocks, so to speak, that I was
Hmm.
talking about, and give up on a very easily accessible tool that helps the vast majority of people with chronic headaches of any kind. Doesn't have to be just migraine. There are only about 5% of people who actually have migraine have been diagnosed and treated. So even if you think you don't have migraine, you just have regular headaches, this all applies to you too.
Mm. Yeah, magnesium is one of those things that it's so depleted that people aren't even getting it in the food that should normally be high in magnesium. So yeah, I agree. That's a really super easy fix. I take magnesium every day. In fact, I was traveling for about a month in March, and I just got off my supplements and sort of forgot about it. And then I started noticing like muscle cramps and things like that. Like, right, the magnesium. So it's super, super easy. So thank you so much for that. Now, Dr. B, where's the best place for people to find you online?
On my website, ameliascottbarrettmd.com, and I have a YouTube channel, same name, Instagram, same name, Facebook, same name.
Okay, perfect. We'll have all of the links there. Thank you so much for being here today and really shining the light on headaches, like this thing that people get so much and just write it off as not being, it's just sort of almost normal, right? But it's not normal. And I love what you said about it is your brain speaking to you. And if your brain was a small child, would you just stop it from speaking, right? Listen to it
Right.
and hear what's going on and then take some of these steps that we've talked about today. So thank you so much for doing the work that you're doing in the world and also for sharing it with our audience today, Dr. V.
Oh, thank you so much for having me here. I appreciate it.
And to all the people watching or listening, do you know someone that has headaches? Probably. So share this episode with them so that they can find some freedom and get their life back and be free of headaches again. So thanks very much for joining us, and I'll see you again.